Welcome to Apollo HealthCast. This show is for anyone who wants to understand the role of preventive health, how to live a more wholesome, healthier life, the role of specialty healthcare in modern medicine, as well as the presentation of common medical conditions and how they are treated. I'm your host, Dr. Aarti Kannan, a consultant geriatrician or a senior care specialist at Apollo Hospital, Bannerghatta Road. Today we have with us Dr. Ravindra Mehta, a senior consultant pulmonologist and the head of integrated pulmonology services at Apollo Hospitals, Bangalore. Dr. Ravi, welcome to our show.
Thank you, Aarti.
I would like for you to introduce yourself to our audience.
Right, so the professional introduction is always a long thing, especially you've been many years in the profession. But to keep it very briefly, I did my basic medical training from some of the best colleges in Mumbai. Then we went over to the US to do training in general medicine as well as subspecialty training, which was not easily available in India at that time, in the fields of chest medicine, ICU medicine, something called sleep disorders medicine, and more subspecialties. So the idea was to go and complete or add to the spectrum of qualifications which are going to help tremendously in not only imminently important patient care but futuristic patient care. So after that, after spending a decade in the US, I made my way back to India, where I've been in Bangalore working in Apollo hospitals for a decade now, and a lot of interesting aspects of seeing two continents medicine, seeing the practice of the field across different areas has been a very interesting story in this entire trajectory of how I have reached here.
That's wonderful to hear. Thank you for your introduction. Now, when you did send me your paper introduction, I noticed that you have some patient principles, the 5 Ps and selfless service. Can you tell us what inspires you to be the clinician you are and how those principles drive your daily practice?
Well, it comes over time. When in the initial years you're trying to figure out the science, there is a sea of literature, as you well know, and you also struggle with that, I'm sure, and how to come landing on the ground with effective care for people. But on the other hand, when you look at it from the patient's aspect, all they want is a compassionate doctor who can put great medicine to them and end of the day put some outcomes and improve the conditions they came with. So when 25 years later, I think it's the basics come back to you, the simplest basics which are told to us when we enter medical college, that care of people is ultimately the professional and personal growth which each one of us seeks is going to come when you have a compassionate approach combined with professional excellence. This is the key. And so in that, medicine is very unique because in this modern time of return on investment and so many such finance-filled words, and where the stock market overrides the COVID numbers, it comes down to the fact that how will you reconcile everything like that? In that, one realizes that selfless service, goal-oriented service, patient-oriented service, and meeting their endpoints probably is the best way to meet everyone's endpoints, including yourself. So it's a long introduction, but it tells us that ultimately do patient-centric care, all the laurels which are supposed to come to professionals will follow automatically.
Wonderful. I think that's something that's inspiring a lot of young clinicians such as myself. We'll go over to some of the questions that we have for today. So we'll start with the most important thing, which is what is the most common condition you come across in your patients? Or what are the most...
So we are chest physicians, so since we wear multiple hats, and that was especially useful in COVID, and there'll be COVID in every part of our chest medicine professionals discussions, we basically deal with a large gamut of patients across the ages, but primarily focusing on the respiratory and critical care space, which is in lay people chest medicine and ICU space. So currently, because diseases decide what we do, the common diseases we deal with as a chest physician are asthma, COPD, or what's known to people as chronic bronchitis, lung damage from smoking called emphysema, fibrosis or scarring of the lungs, which people came to know about in COVID, called ILD, lung cancer, which is so much on the rise at this point, infections such as tuberculosis, the viral infections which have swept us space, and they just seem to be coming one after the other. So these are a few entities we see on a regular basis.
Okay. Would you recommend that there's any particular preventive measure or measures or lifestyle measures that we can incorporate in our day-to-day life so we can lead a healthier life from a lung standpoint?
So respiratory health came to the forefront between the years of 2020 and 2022 like never before. COVID-19 catapulted the chest medicine space into one of the most important things. We've never seen the earth come to a standstill as it did, where the entire 8 billion population was focused on only one thing, and how over it not only ended in 2 months, but it took 2 years to at least recover from it and learn so many things from it. That has put respiratory or chest medicine health on the forefront. Is it a new thing? Actually, not really. Let's face it, we've been talking of pollution for a while. Pollution leads to lung diseases, and it's very simple. Unlike your liver or some other organs like the heart, the lung is directly exposed to the environment. So an attack by a pollutant, whether it's an exhaust pipe or it's a smoke generation from some factory, or it's walking into a dusty building, all of those will impact me, and impact me within seconds or minutes. Understand that is the difference. Blood pressure doesn't develop overnight. Diabetes doesn't develop overnight. Heart disease doesn't develop overnight. But chest disorders of acute nature and which can lead to chronic problems are very, very quick when they come in. So we now have to realize that we are living with a vulnerable system open to the environment. So we have to now look at how we can protect ourselves. Well, in an ideal world where Aarti and I lived in utopia, we would have a beautiful environment. We don't have that. So that is something we have to understand. So on the environmental aspects, it's all about pollution and exposure to all sorts of irritants. Now, what to do about it? We can have a podcast on this by itself, but it comes down to the fact that we have to ultimately look at all measures to improve the environment. That is usually a system thing, and further helped or assisted by each one of us. So will the governments do it? Will the world as a whole do it? Will these agencies do it? And will each one of us who adds to it be a part of this ecosystem? So the largest partnership that we have known for 8 billion people or 16 billion lungs needs to get together so that we can live a healthier life, a longer life, and also prepare for the next generation, which is so much our responsibility. So in a nutshell, environmental protection. Now you'll ask me, all this is great stuff, but tell me what to do on the ground. On the ground, you have to protect yourself. You have to, wherever you go into dusty areas, polluted areas, if your life needs you to go on two-wheelers, if you are in any sort of profession which requires exposure, the one entity which came to center stage in COVID-19 were masks. And N95 is again known to even a 5-year-old child at this point. So if you can get the right mask at the right time, for the duration of exposure, no one's asking you to wear it medically like us, then you can probably protect yourself much more. If we had this podcast 3 years ago, it would have been a simple mask. As of now, 2023, N95 available for cheap, given free in so many areas, is the protection one can use. So I think I've laid the stage for the fact that on a common sense level, let's work with everybody for the environment. On a specific level, avoid all these areas. On an absolute protection level, you follow these masks. And if you're in a profession which requires exposure, going down into ditches, this, that and all, then usually there's all sorts of guidelines and things available to protect us. Interestingly, post-COVID, this is now much more accepted and available than it ever was. So I think it's a revolution of sort which is coming now, and the basis is that single question of yours: how do we protect and prevent our lung from getting damaged so lung health goes on?
Is there a particular disease or condition that develops as a result of air pollution?
Absolutely. So air pollution is the biggest villain around, and all of us now just wait for 3-4 months and the newspapers will fill with Delhi being a smog area, how the emissions can be reduced, how they're trying to do alternative vehicles and so on. It becomes a nightmare. Very shortly you will have a survey from all over where we will have 2 or 3 of our cities as being the most polluted in the world. So this is an endless story by and large. So with the link of this to diseases has been looked at for many years. And it is pretty much linked to either causing a disease or, more important, ladies and gentlemen, worsening my existing disease. If I am an asthmatic for whatever reason, then it's not that I will be safe when I'm exposed to all this. These things will worsen us. So these two entities have to be looked at: causing a disease and worsening existing disease. So this per se has been linked to air pollution, where air pollution is known to cause asthma, per se is talked about. Worsening of asthma is definitely talked about. These entities called COPD or bronchitis or emphysema, more infections happen, more allergies happen, quality of life goes down, children can't go to school, productive people can't go to work, elderly get sicker and reach hospitals and healthcare, which makes the whole ecosystem go topsy-turvy. And then in the long run, chronic diseases are known. It goes beyond the lung also to other organs, which we will not dwell on today. And even that dreaded word cancer has been touched on in discussions and in literature. So it's a whole menu card. And the interesting part is we don't want to make these podcasts scary. This is awareness. I mean, we live in a lovely world. Things are great for us. We have technology, availability, movement, knowledge, excellent doctors, great healthcare. But at the end of the day, you have to mix and marry everything so as to have a productive life or a productive lung life.
Let's talk a little bit about senior care, which I'm very passionate about. I would like to understand how we can optimize lung function and lung health for older adults or older individuals.
Absolutely. I was waiting. I said, Dr. Aarti being an eminent geriatrician, well trained from overseas and trying to change the landscape here, must get to this part of it. So let's look at some basic data. It's my bank account. How much money do I lose every month? So in your lung bank account, you actually start losing small amounts of lung function every year. There are specific numbers for that, but it's a very tiny amount. And this starts at the age of 35 to 40. So you young people, you're going to have a gala time, but watch for a while. After some time, it's going to be inevitable. In the relatively elderly population, and that's a debatable term, what is elderly, after 60, 70 years, the rate doubles. So twice the amount of lung function will be lost every year as per Mother Nature's rules. If I add to that smoking, I add a third fraction to it. So if I'm a smoker and the years are passing by, I'm going to lose more and more lung function every year. Is environmental pollution equal to smoking? It's a big question. Currently, the pollutants are now likened to cigarette smoking literally. So that's another problem. If I live in a gas chamber, I may be also affected by that. So we're going to lose lung function. So this is the catch out here. So when you know that, you actually put more measures to try and hold on to what you have and improve it and not lose it. And so the preventive aspects are like so. Learn more about this, become more aware, try to avoid all the areas which can cause lung damage, as we talked about. If you are ill, seek help and go to the right people. Yoga, pranayam, healthy practices, naturopathic stuff, great. Go to a practitioner, but the impact on disease, nobody knows. Impact on prevention, well documented. So please go ahead and do it. Opening your lungs is lovely. The role of living a healthy life, exercise, diet, nobody knows more than you. You advise your patients every day. Absolutely invaluable. Okay. And then if you get by chance hospitalized or get into healthcare, then you are flagged as high risk for worsening. Very important that you give due importance to whatever has to be done to both reverse lung health issues and prevent further problems. So this is it. Ultimately, lead a healthy life. Don't smoke. Quit smoking. Passive smoking. Friends who smoke are not friends. Let's remember pollutants, as we talked about, diet, nutrition and healthy practices all will go a long way.
Awesome. Now, I've also noticed that many of my older patients who have chronic lung ailments, they are on something called as pulmonary rehabilitation or pulmonary rehab. In common terms, lung rehab. Can you tell us a little more about its role in the management of lung diseases and how it actually benefits individuals?
Right. Pulmonary rehabilitation or lung rehabilitation is actually a common sense term. Lung is intuitive to everybody. Rehabilitation is a fancy term we use for anything, any improvement in any organ system which allow us to be more functional. If I hurt my knee or have a fracture and suppose I have to go through surgery, I need rehabilitation. Same thing happens with spine, any other area. So orthopedic and sport rehabilitation is known. Some big cricketer will have a joint replacement. You'll be following Agog. The 3 months he had rehabilitation and he came back. There is lovely stories about horses who went down and they came back after rehabilitation. So now switching to what you asked, lung rehabilitation is based on two understandings. One, can I, with the expert's help and all the information available, use some tips and tricks to improve existing lung function? And everybody will ask one question, yoga and pranayam. So that's integrated into that. So by the professional, because he uses multiple tips, tricks and toys to try and get you better, including some props. The second is that the secondary effect of the lung going down on other organs is never talked about. If my lung is weak and I don't move and I get weaker and my posture is going down and I have not climbed steps in ages and so on, my muscles get weaker. The same muscles supply my chest wall. So all this needs to be strengthened. So how to get somebody more functional, how to get them to use both lungs, muscles, the whole system, how not to worry and panic and get anxiety, which is such a big problem, and how to ultimately become a self-sufficient human being who can live productively in their ecosystem is the aim of this entity. It's been there for donkey's years, Aarti. It just doesn't reach center stage because it is slow, it needs labor and effort, and it needs dedication both on part of the professional and the person afflicted so as to make it happen.
Thank you. In addition to improving quality of life and improving independence in living, has lung rehab shown to increase lifespan?
Absolutely, because as you said, quality of life means I'm a happier person. I can climb steps. My God, I could never do it. I can go to the bathroom. My son, my brother, nobody needs to help me by and large. So that's quality of life. If I do that, I require less healthcare because I'm more independent. So that's actually great for both my status, my family, and healthcare utilization. End of the day, as we say, though we work in hospitals, we don't invite people to come and meet us. They meet us when there's a endpoint to be served. And lastly, if I do all this, then there's a strong chance that I'll ultimately live longer. So anything which makes me functionally better and I put focus on it will lead to improvement. That's the whole simplest way of putting it so that all of us can understand.
You did touch upon how the lung is interconnected to other organs, and on a parallel note, what I believe in is that we've understood healthcare much more in the recent years than we ever have in modern medicine. And we've understood that the human body is a very beautiful, intricately interconnected machine where organs and cells don't function in a silo. They're all interdependent. They all function in unison. Can you tell us a little bit more about how lung disease or sleep apnea can affect the heart?
Right. So the first aspect is that does one organ system affect everything else? If I have a gut problem, is it going to affect my lungs? If I have a lung problem, will it affect my muscles? And is the heart going to get affected by all these? All these are very valid. As you said, it's one continuum. There's so much awareness coming in that there are at least maybe 1 trillion things which are happening, and all of them in sync give us health. Don't forget, guys, it's not about illness, it's about reversing illness and promoting wellness. It comes down to that. So end of the day, a deeper understanding of this by people and healthcare professionals will go a long way. Can we implement it? And that's the challenge. We ultimately train in subspecialties. So we are very great at what we will do in a particular subspecialty. At the same time, we open our blinkers and try to integrate that organ care into the bigger picture of life. And that awareness is spreading across the profession. The second part is something called sleep apnea. Now, sleep apnea is a very unusual, not unusual, it's a very interesting entity. It's actually known for the last 50-60 years. And in short, it goes back to, some of you like reading Charles Darwin and the Pickwickian papers when the fat boy used to snore. And as he snored, he used to keep sleeping. So the whole thing is understood simply that if I am heavy, overweight, my airway is tight, then the space for air to go in comes down. We convert a highway into a lane in one of our urban cities, whether it's Bangalore or Mumbai or whatever. In such a situation at night, when the muscles relax, at that point you stop breathing or breathe less. You can't stop breathing, that's not compatible with life. So the mind wakens up at that time and basically you get disrupted sleep. So every night you're not sleeping well. If you try to sleep 8 hours, you're getting 3 to 4 hours. You're awake most of the time. You're tired. You're exhausted. You have no energy. And this reflects on other organs. Wait it out, and after some time, blood pressure will come in, diabetes will get worse, and then heart disease is a risk factor. So why it's not caught is, first of all, it's a lifestyle disease. The closest association you have is loud snoring. All loud snorers who are on the heavier side should actually think about this very carefully. Some of those 4 a.m. deaths and 5 a.m. deaths we talked about are because of severe sleep apnea also. So to make it simple, a narrow airway leading to sleep disruption with its impact on other areas such as blood pressure and heart is the main problem out here. Now, why are you even mentioning it? Because we are in the midst of a obesity pandemic. COVID is the acute pandemic, obesity is the chronic pandemic. As we got affluent and we are now pouring, with calories all over the place, obesity is on the rise, childhood obesity is on the rise, sleep apnea is on the rise, and its impact on all the other organs is going to come up, including heart disease. So currently we're looking at a whole bunch of these lifestyle entities which, if corrected, are the basis of wellness, which if not, need healthcare with all the stuff we discussed.
What is the best way to diagnose or look for these ailments, whether it's lung ailment, screening for a common lung ailment, or screening for sleep apnea?
So the whole thing comes down to, should we screen anything or should we just look at addressing a problem as it arises? Do I look for problems or do I come to a doctor when I have cough, wheeze, can't breathe and so on? For years, people have tried to say preventive is good. How preventive can preventive be? Do we go for these health checkups and so on? It's an internally debated question. As of this point, it seems to be that at least if there is family histories or there is some early symptoms, or if you have the luxury, then you should go towards preventive aspects. Then there comes down to early symptoms. If you get an early symptom and the ballpark figure is around 3 months, if it persists for a while, please don't ignore it. Now, the earlier you catch it, there's a strong chance the earlier you're going to fix it. And then it comes down to what tests are required to screen it. Fortunately, there's not a lot of stuff required in lung disease. It's very simple. As I keep referencing COVID, the one entity which everybody has in the houses, had at least until they got spoiled, is the oximeter. It's remarkable how oxygen level is known to everybody. So it's simple things like taking a professional will talk to you, your oxygen is measured, which you may do at home also, and then figure out. And then after that, if required, an X-ray, which is so simple to understand, a lung function test, and then advanced testing may come. So most health checkups offered nowadays will include these basic things.
So I know that ABAPS, or Apollo Bangalore Advanced Pulmonary Services, just recently did its first successful lung transplant in March 2023, and that was led by you and your spectacular team. Can you tell us a little bit more about how the experience was and what are the criteria for a lung transplant?
So we know that transplants have been in the landscape of healthcare for a long time. We know of kidney transplant, we know about eye transplant, which has given life to so many and vision to so many, and then it picked on to become liver, in some measure heart, and lung has been the relatively more difficult to do newer kid on the block. Now, to understand this for a person who's not in healthcare is to understand that ultimately you have to complete the spectrum. Anybody walks in through the door, you can talk all the prevention in the world, but when disease afflicts any one of us, if it's either luck or whatever, then we have to have solutions. The rightmost part of trying to give a solution for advanced lung disease, or we call it lung failure, is lung transplant. And it's not easy. So it's not easy because it involves basically, a lung coming from somewhere. Usually these are people who've had an accident or, have something called brain death when they reach a hospital. Very unfortunate. The families are graceful and in their misery agree to donate, and then a widespread activation of the whole system happens. It's a policy thing where it's posted, the teams who do it come in, there is all sorts of evaluation done. In the back end, people like us will have a good number of patients who are waiting for it. They get triggered, the match happens, and then the surgery is done, and then their care continues for a long time. So it's a high-end product which is there. We are happy to offer it as a completion product. Having said it, obviously, whenever I see a transplant, in my mind it's always what could we do to reverse all this or prevent this for the next few people to come. So our discussion, much as we talk of this entity being available, is as much based on the fact that, ladies and gentlemen, do whatever it takes to maintain your health, because needless to say, and the old cliche statement, a healthy body is actually probably the biggest wealth you can ever accumulate.
So who would you say, who in your opinion needs a lung transplant?
Lung failure, advanced lung disease, oxygen dependent. So we saw that again in COVID times and so on. Though COVID times people improved a lot, that was saving grace. So advanced lung disease, nothing more can be done. Everything has been tried by multiple experts. It's either going to be demise or poor quality of life, or that gets elevated by getting a new pair of lungs.
Okay. So we'll shift gears a little bit and talk a little bit more on preventive health. I want you to elaborate on how we can optimize lung function for high performance athletes or those who are engaged in high intensity exercise.
Right. So the whole system, as you said earlier, is based on having an excellent overall lung, heart, musculoskeletal as we call it, and entire body which is geared up towards giving you that push when you actually launch on your high intensity exercise or become professional athletes and so on. And it is a science by itself, and in modern times it has reached a level we never saw before. There are professionals, there are coaches, there are training institutes. The modern cricketer, the modern soccer player is a fitness epitome by himself or herself. It's really amazing. And so the training part of it comes down to everything which is, I think, known to people: nutrition, discipline, strength building and so on. But from the lung point of view, usually it's the general aspects. Take the lung as being one of the important areas to address. So obviously all the exercises which lead to strengthening will improve lung function, and then comes don't put anything bad into your lungs. So smoking is a big no-no, and it's attractive for them because they're moving in all these places, smoking. And let me add to that important term: e-cigarettes and vaping. Vaping is the in thing now, right? From schools all the way to plush and for futuristic society. Well, not futuristic, so-called forward-thinking society. People pick it up. It's legal abroad but illegal in India, but it's all over the place. So smoking, hookahs, vaping, all of that is a no-no for these people. Discipline is very important. You cannot undermine nutrition and sleep. It's so important for all this. Then when you start exercising, you will discover that you may have exercise related wheezing. It's quite common nowadays. That can be worked on very well. So in a nutshell, general stuff which we talked about and specific stuff to the lung, including preventive aspects, would go a long way in trying for the athlete, the aspiring strong exercise person or the professional to reach their goals.
What do you think is the role of AI or artificial intelligence in lung health going forward? Because right from asthma management to COPD management or chronic bronchitis management, it's being talked about and researched everywhere. Everyone is talking about machine learning, artificial intelligence, and what role is it really going to have in the near future in the management?
So AI is invading everywhere. I think last 4 months have been ChatGPT, impact on Google, Microsoft, slowing down, accelerate. It's endless. I think it's just the buzzword of 2023, and maybe it will be the buzzword of the decade. Now, medicine AI has been going on for a while also. It's slower. It's much slower because the first thing you want is safety. The second thing, you need proper data sets. We are so individualized in our approach because we want to make sure that what is required for you or me may not be the same required for our parents or our friends. So it's been very difficult to get standardized data sets. Having said that, in areas where technology has come in, like say X-ray or radiology, CT scans, pathology, it's actually now starting to go from a little walk to a slow gallop now. So we know now that chest X-rays are able to be read by AI, CT scans are going to be happening shortly, pathology is actually going on that route. So everywhere, think tanks, university-oriented smart people, Western world, and India also, everyone is now putting their energy into all this. Where do we see it going? Ultimately, processes will get simple. Wherever there is a standardized process where we can do as good or better than current standards, AI will come in part or more, by and large. Where will it less likely come in is where we have rapidly moving points, intensive care, status changing, the humanistic touch, which can never be replaced at this point, we feel, by AI. And maybe I'll be wrong, in 25 years later there'll be something which can do it, but at this point it can't be. So it is there. it cannot be looked away. There is the proponents and there is people who are pushing it to one side. It will make its way like EVs did ultimately. It will move slower in medicine. We'll have to be cautious about it. There will be everything from insecurity to embracing when it comes to accepting it. But end of the day, we'll see its penetration.
Do you think it's going to help with the management of conditions like asthma, where even seconds and minutes can turn around a patient's outcome?
Yes, it will. And we've been analyzing this in our mind where all it can happen. Certainly, wherever there is, for example, remote monitoring. If it is given to somebody and they trend it and they enter it, then an AI tool will pick up the changes much faster than my lovely busy doctor who's seeing 30 people in a day and cannot put all these data points together. See, even presenting data to a professional in a way better than the professional can collect it or the system can collect it is a manifestation of AI. So people will find these nooks and crannies and small areas and some very important and some just process improvement, which will probably make a difference in the way we treat our patients.
What are you most excited about in the upcoming 2 years in the field of lung health?
Well, I feel that if you just dial the clock back, because this is a panoramic question always, it has to be taken over a period of time. Dial the clock back 5 to 10 years, or dial the clock back 30 years. Lung was tuberculosis in India, nothing but that, and maybe some infections. And then in the last 2 decades, we saw a revolution of understanding, acknowledgement among people that we need help, new diseases coming, more technology coming. When that happens, you start treating disease better. And diseases which were not taken care of obviously will shoot up more. Already there was a lot of attention on the heart and many areas. So, things will move slowly when you put all your resources. But when you put less resources on the lung and you suddenly realize there's so much more to do, it became fascinating. So, though I was meant to be an ICU doctor, I piggybacked onto chest medicine, and today we're talking more chest medicine than ICU care. So I think it's now a revolution in terms of the need for respiratory health. So this is going to be from the field point of view. From the people point of view, it's just going to go up and up. As we age and as our cities get more polluted and there's not much which is happening on the ground right now, and as lifestyle diseases come in, we're going to see more and more of this. So let's gear up and let's figure out that this is there and look at it carefully. What is interesting and exciting for us is the fact that can we, with so much understanding, not only do we see the last 30 years, but we can see the next 10-15 years, put energy in trying to put a full juggernaut of a clarion call for preventive care out there. So we don't want to see you. That way you can take care of yourself. But where you get stuck, where you're in the swamp, where you can't get out of the dark tunnel, we can use excellent healthcare, technology, skills, compassion, and put it together in a unique model to make a difference. And last but not the least, integrative care. We cannot treat one organ in isolation. We integrate that just like you do so well in your elderly population and give people what they really want, wholesome care. So I think the next decade or two is going to be full of both surprises and very interesting new developments which will keep us on our feet all the time.
Okay. What would you say are your main takeaways from today's talk for all of our listeners?
So the thing is, if we summarize what we've talked about, lung health has come to the forefront. It was always there. COVID-19 brought it to the center stage like never before. The most exciting part was the fact that countries decided to put more GDP into healthcare, which had never happened. Sadly, that took a little backseat because of the wars in the worldwide arena, but one hopes that will come back. The people at large, and what a lovely thing we have seen, they're so much more aware and they want to prevent stuff. On the preventive aspect, people are putting more and more energy. They look at quality of life more important than asset collection, which is so important, so they're willing to put resources into healthcare. Technology went into fast forward. Technology which was hidden in the wings, such as oximeters and all that, came to center stage. Acceptance is more for things like scans and so on, and ultimately professionals also are now looking at the whole thing with so much more wholesomeness and respect to try and make a difference. And then last but not the least is going to be the fact that knowledge and skills and technology are three brothers who are galloping right now, and with the increasing requirements, we trust, believe and know that as a system we should be able to put so much more to try and make a difference. So it is a revolution in healthcare which is coming, and in lung health in particular.
Well, I would like to thank you for being here with us today and sharing such wonderful insights, educating me, educating our listeners on the importance of maintaining good lung health, how to prevent ailments, how to take care of yourself and go and get tested, go and get treated in a timely fashion, the role of so many things like artificial intelligence, pulmonary rehab, how to improve health in high intensity exercise and high performance athletes, older adults. So I'm very thankful to you for your time today. With that, we come to a closure on our first episode of Apollo HealthCast. I would like to thank our listeners for your time and patience. Stay tuned for the next episode. Signing off, your host, Dr. Aarti.